Here at St. Louis Children's, we see a lot of kids who are referred for their tonsils. We do a lot of tonsillectomies here. And so questions that often come up are, well, when should we do this? What are some of the things that we think about as we're scheduling surgery? So a lot of it's going to depend on how severe your child's condition is. For example, if your child is really impacted by the number of recurring bacterial tonsillar infections, such as strep throat, you may feel like it's better to go ahead and proceed now rather than to wait. If your child has really bad obstructive sleep apnea, then tonsillectomy and adenoidectomy may be one of the first choices that we recommend for intervention. Are there any other factors we take into consideration? Absolutely. Remember, this is not an easy procedure for you or for your child. While the surgery is pretty straightforward, the recovery easily can take at least a week of being out of school, and for older kids, it can take even longer for that. When it comes to physical activities, we often recommend for kids to keep out of those very strenuous activities for at least about 10 to 14 days. That can have a significant impact on you and your child's time. Lastly, there is always a risk of having bleeding after surgery. And so I do recommend to families, if you have a major trip, if you have a major event or something else that's planned, and it's taken you some time to try to be able to get that all coordinated, if your child's condition is not very severe, you have the flexibility to work around that major event you have planned. We are happy to talk about all of this and more with you here at St. Louis Children's Hospital.